MRSA. I don't know if any of you know what MRSA is. It's a product of a staph infection, which was a once treatable bacterial infection that has become a growing problem in the healthcare population today, mostly due to the overabundance of providers overusing antibiotics as well as increase in the urban population. The CDC has now established MRSA as a high priority by establishing both long and short-term goals and joining forces with international healthcare departments, hospitals, and military groups to establish universal guidelines to be effective against MRSA on an international level. The purpose of my speech is to inform my audience about MRSA and ways it can be prevented in the healthcare and in the community settings. The importance to my audience is anybody can get MRSA and not just healthcare providers, and it's important for my audience to be well informed on ways to prevent MRSA and what to do if you get it. So in 2005, 19,000 people actually died from MRSA, so we should obviously be worried about it. What is it? How can we prevent it from spreading? And I will now discuss the history of it and clear-cut ways to avoid the transmission of it. The definition, staph is a bacteria that's been traced back to the 1800s. According to the 11th edition of Intro to Microbiology, staph is a bacteria and is classified as a bacilli. Staph is a bacteria that lives in the nose, and everybody has staph on their body. Most healthy people don't even know that they have it. It only becomes a problem when it enters your body through a cut or a scrape and becomes deeper into your skin. A well-known surgeon, Joseph Lister, also the person that invented Listerine, was the first person to realize that air could possibly lead to the breakdown of your skin post-surgery. In the 1800s, another surgeon, Sir Alexander Augustine, went one step further to research and found that pus was actually causing bacterial infections after surgeries, because most people were getting MRSA post-surgery. He was responsible for naming staph because when you view it through a microscope, it looks like little grapes, and it actually originates from a Greek word meaning little grapes. In the 1940s, we began treating staph with penicillin. And we were successful. And then, according to the University of Chicago Medicine Research Center, the rapid development of methicillin-resistant Staphylococcus aureus, also known as MRSA, which is something that hospitals are still battling with on a dangerously increasing level. And by the 1960s, penicillin, we couldn't use penicillin anymore. It wasn't effective against it. So we moved to stronger antibiotics like vancomycin or methicillin. The more providers used it, the less it became effective, and in 11 years, staph was no longer resistant to methicillin because the bacteria had morphed and become resistant to antibiotics. Most people are going to be like, what's the difference between staph and MRSA? There really isn't much of a difference between staph and MRSA, other than the fact that the way that the two bacteria will respond to antibiotics. MRSA is now considered a superbug, and MRSA is now considered a superbug, and it's developed over years of excessive use of antibiotics to treat infections. And antibiotics are even in like our foods that we eat. Some people have antibiotics in their water supply. So now there are two types of MRSA. So there's hospital-acquired, usually meaning that people go into the hospital, be completely healthy, and have a surgery or something and leave the hospital with MRSA. So that's a huge issue for people that work in the healthcare industry today. This could be something as simple as nurses not washing their hands or doctors not using aseptic technique. I personally work in a hospital where a nurse was in a patient's room and walked out, and the patient had MRSA, and she touched the side rails of the walls, and then doctors came around, and then they touched the wall, and then they went to the patient's room, and there was a huge outbreak of MRSA. So it's very easy to spread. Very, very easy to spread. So in some cases, it can enter your bloodstream, and you can become septic, and you can die. So community acquired is much more of a problem now because of urban population. It's popping up in childcare settings, prisons, athletes are even getting it, like wrestlers, due just to close proximity of people living near each other. So signs and symptoms, staph usually just looks like a red bump or a mosquito bite, and Usually the only way people will know that they have this is if they go to the doctor. The doctor will take a sample, send it to the lab. The lab will then run a bunch of tests on different antibiotics, and will come back and will either decipher if it's resistant or if it's susceptible, and then they'll put you on a antibiotic that will be successful in treating it. Easy ways for general public to not get MRSA is to wash your hands. This is true for everybody. Keep your cuts and abrasions covered. Don't share razors, towels, clothes. If you're an athlete, shower after you've been exposed to people who sweat on a regular basis. If you're in the hospital, gown up, gown, mask, everything when you're in and out of patients' rooms. And it's important just for people to know that MRSA is out there, and to wash your hands and to keep yourself covered.